Hello, everyone, and welcome to another video with me. My name is Sierra, and I am Head of Operations with Academic Coaching for World Changers. At this point, you should be following a part 2 of a part 1 series. So part 1, we introduced the first 5 questions of our Quick 10 pocket prep questions. We explained a little bit of what pocket prep is, how to access it, and reviewed the first 5 questions. In this review, we talked about knowing why the right answer is correct and why the answer you thought, which might have been wrong, is wrong. So really understanding about the quality of your study, not just getting through the quantity of questions. We also talked about how there are references at the bottom, thanks to Pocket Prep, to learn more about this information further. If you don't already have your study materials with you, you can refer to these study materials as well. So we're going to keep going to the second half of our questions. Question number 6. When should formal treatment planning take place? A, following diagnosis before case conceptualization. B, at the end of an episode of care. C, at admission or intake. Or D, following diagnosis and case conceptualization. If you don't know these terms, make sure you study them. All right. So when should formal treatment planning take place? I'm going to take a guess here. Pretend I am you and you are me, and maybe we haven't studied this. Maybe we think we know, maybe we're not sure, maybe we 100% know. Think about, are there any questions or answer choices you can eliminate? I'm going to go with C. And the correct answer is D. All right, D as in dog. The correct answer is D because treatment planning is meant to provide a therapeutic roadmap with which to address a patient's presenting needs. It generally takes place following a diagnosis in case conceptualization, when enough information about the client and their needs is present with which to make a plan to help them. So maybe some of you knew this, like, oh my goodness, Sierra, it was totally D. I knew it was D. Maybe some of you thought it was C. Maybe you definitely knew it was D, but you still picked A, B, or C. Make sure you know why you chose your answer, and then make sure you know what the correct answer is and why. So if you don't know when treatment planning should take place, this is a great question for you to study. Also notice that they're giving you an order in the explanation details. So just because this question is asking it this way on the exam, it might ask it another way. Question 7. What is the goal of consultation? What is the goal of consultation? Not what you think the goal is, but what is the exam asking for? What is the goal of consultation? Some of you with lived experiences post-school sometimes might confuse maybe what happened at your internship or what happened at this job versus what the exam is asking. Remember, the exam has no context of your individual lived experiences. All it knows is what the textbook and the materials have to offer. So what is the goal of consultation? A, to increase a counselor's ability to handle problems in the future. That's A. I think I said B. A, to increase a counselor's ability to handle problems in the future. B, to strengthen the counselor's documentation skills. C, to decrease the possibility of ethical dilemmas. Or D, to triage clients whose needs may be better met elsewhere. If there's any vocabulary in this question that you do not know, pause here and look up the answer. What is triage? If you don't know what that means, look up that term. Don't miss a question just because you don't know a vocabulary term. If you don't know it here, you won't know it on the exam. The goal of consultation. Any answers you can eliminate? I'm going to take a guess. I'm going to go with C. Did you also think it was C? Did you think it was B? Did you think it was D? Because the right answer is A, okay? A, The correct answer is to increase the counselor's ability to handle problems in the future. Counselors may seek consultation voluntarily to problem solve and learn how to function more effectively with groups, individuals, or organizations. The goal of consultation is preventative in nature, as it aims to increase competence so that the counselor can avoid future problems. If you don't know what competence is, look up that word. Consultation can focus on content, such as knowledge about a particular area, or it can focus on process. If there's any vocab words here, pause here, take notes. If you knew this answer, woohoo! If you didn't know this answer, it's okay. Why did you think it was C? What were you thinking about? The correct answer is A. Can you understand why the correct answer is A? Could you answer this question a different way if it showed up on the exam? Do you need the references at the bottom? That's the best part about Pocket Prep, that there are answers at the, the best part about Pocket Prep is that there are references at the bottom to help you better understand the answer. You are not alone. You got this. Let's keep going. Question 8. All of the following are true about the white identity development model, except. Here's another except question. We had one of these questions in part 1. Except. If you don't know what the white identity development model is, what should you do? Pause here. Make sure you know that term, then keep going. Although whites experience societal forces, they do not often experience introspection or dissonance. If you don't know those terms, pause here and look them up. B, the final stage of the white identity development model is integrative awareness, from which a non-racist identity emerges. C, the stages of the identity development model are the same for whites and for minorities. Or D, whites are exposed to racial beliefs and attitudes. Let's go back to the question. Remember, as Dr. Pam says, the hint is in the question. All of the following are true about the white identity development model, except, I'm going to take a guess here like I've been doing. I am you, you are me. C? The right answer is A. Did anyone else think it was B or C or D? Did you totally guess A? Let's hit show explanation. One of the great things about Pocket Prep, you can hit show explanation. The correct answer is A. This is an except question. If you don't know how to answer except questions, you can think to yourself, which one of these are true? How many of them are true? And then you can go and eliminate. The correct answer is A. Although whites experience societal forces, they do not often experience introspection or dissonance. Now, this is based off the white identity development model. That's a term you should know. The racial/cultural identity development model refers to a conceptual framework that helps counselors better understand clients who are of different cultures. There are 5 stages of development for individuals in the minority, race, or culture: conformity, dissonance, resistance and immersion, introspection, and integrative awareness. You should know those stages, you should know the order, you should know those terms and what they mean. Can you think of examples of each? Whites may also go through similar development because they are not immune to societal beliefs such as racist attitudes and poor treatment of minorities. Whites can go through the same stages as members of a minority culture, culminating in the final stage. If you don't know what culminating means, what should you do? You pause here and you look up that term. In the final stage, when they solidify a non-racist identity. Okay, great job, everyone. Let's keep going. 2 more. Question 9. Who created the term eugenics and was one of the first individuals to study intelligence testing? Who? This is knowing your theorists. You should study all of those theorists. You should know those terms. That way you know when to eliminate and when to pick them. Don't just guess and keep going. Learn the question, learn the answer choices. People who pass learn these things, okay? Who created the term? And they're giving you a hint. and was one of the first individuals to study intelligence testing? Anything you can eliminate? Anyone know it right off the bat? I'm going to guess B because of the Binet IQ, the Stanford Binet IQ. I know that's intelligence. Remember, there's 5 types of assessment and testing that you need to know. Can anyone list them off? We covered them in the first video. Aptitude. Does that sound familiar? Intelligence, interest. Can anyone list the others? If you don't know what I'm talking about, pause here, study that term. I'm not going to give it to you all the way. Watch the first video. Ah, I thought it was B. Did anyone else experience that? Did anyone else try to go there? Is the right answer A? The right answer is A. Okay, so what we're experiencing is a live process, right? A live think through. A is the right answer. Sir Francis Galton was a cousin of Charles Darwin and studied anthropology, and intelligence in the late 1800s. So there's a double hint there, right? We're not just looking someone who studied intelligence testing. We're also looking for the term eugenics. If you don't know that term, look it up. He believed that intelligence was completely determined by genetics and therefore could be cultivated through selective parenting. Eugenics refers to the process of genetically improving the human population. Everyone got that? Pause here if you don't. Question 10. 200 college students. Question 10. Start again. 200 college students are enrolled in a genetic biology course. Half comprise a control group, while the other half are randomly assigned to participate in an hour-long interactive seminar each week. Students' final test grades are examined at the end of the semester to determine whether the seminar was associated with better comprehension and understanding of the course concepts. What type of research design was used? Research question. Let's go back. 200 college students are enrolled in a genetic biology course. Half comprise a control group, while the other half are randomly assigned to participate in an hour-long interactive seminar each week. What type of research design was used? Anyone have a guess? Do you know these terms? Have you been studying these terms? If you don't, pause here and go back. Any terms you can eliminate? I am you are me. I'm going to take a guess, okay? Maybe I'm torn between A and B. Maybe I don't know. Is it a true experimental? There's only one way to find out. The best part about pocket prep is you get to guess. And if you get them wrong, you can actually go back through and filter through these questions again, your missed questions. That way you can study them again and get them right. I'm going to go with B. And the right answer is C, true experimental. All right. So why is it true experimental? Let's go back. Researchers can choose from several different research designs depending on the purpose of each of the research, as well as time, money, and people that are available and willing to participate. A true experimental design uses experimental groups and control groups that are comprised of randomly assigned participants. Researchers who use experimental designs typically want to determine cause and effect relationships, like the relationship between test grades and a differently formatted seminar in this example. So the right answer is a true experiment, or true experimental, because of we've got that experimental group and the control group. All right, so I'm going to stop share here. Now, obviously, I got some of those answers wrong on purpose. I wanted you all to experience that live experience as if you were taking the test. When you start studying, you don't get every question right. You have to go through the ups and downs of thinking you got it right and then not getting it right. So just know at Academic Coaching, we will thoughtfully and effectively prepare you for your exam. This video is a walkthrough, a simulation of what it would be like if you were taking these questions yourself. So I just want you to feel confident that if you're in the hands of academic coaching, that we will totally and definitely prepare you. My name is Sierra. I'm a former research and assessment specialist with academic coaching. I've now moved up to our admin staff, so I'm head of operations. So I no longer coach, but I will continue to do videos like this because I want you all to feel prepared for your exam. Again, this was a walkthrough, so I don't want you to walk away thinking, wow, my coach is getting all those answers wrong. Why would I study with them? Because I wanted to give you that real experience of sometimes when you're studying in your seat, in your car, at work, you don't always get the answers right. Here's what to do with Pocket Prep. You hit show explanation and then you learn more. All right. So thank you so much for watching this video with me. I'm looking forward to seeing you all in our next video. I hope you have a great rest of your day.